Peace be with you. So I usually make videos about faith and religion, but I'm also an emergency room physician, and I wanted to make this video about work restrictions for healthcare providers with COVID infection and exposures. So this guidance just came out. So it is from CDC, and I wanted to show it because I am very much bothered by the way science is manipulated by people for political purposes and completely abandoned. So this guidance comes out with a background of healthcare workers being fired for not being vaccinated for COVID. So what does this guidance say? So people who are healthcare workers who are infected. So this is for people who have an infection. So what it used to be 10 days or 7 days with a negative test. Okay. But now what they're calling a contingency, and this is what people that I most people, especially up in the Northeast, are going through this already because of the Omicron. They're saying that if you are a healthcare worker and you have, look at this, boosted, vaccinated, or unvaccinated, contingency is 5 days with or without negative test. So what that says is if the situation demands it, it doesn't matter if you are boosted, vaccinated, or unvaccinated, you can come to work in 5 days, right? Now in a crisis, there is no work restriction, right? So now if your infection is mildly symptomatic or asymptomatic, you can come to work and expose whoever you want to COVID. It doesn't matter who you are. But if there is no crisis, we will fire you if you did not get vaccinated, even if you had a previous infection, and even if you're not sick, and even if you are wearing a mask and getting whatever. But if we need you, it does not matter if you're vaccinated. It does not matter if you're boosted. It doesn't matter if you're unvaccinated. If we need it for contingency or crisis purposes, you can come back to work if it's not too bad within 5 days, and you can come back in a crisis. There's no work restrictions. You can have COVID and come and work with COVID. So all this stuff about exposing innocent people to a virus is ridiculous. And I'm sure that they're finally understanding that vaccinated people transmit the virus. So don't get me wrong. There is plenty of evidence that says the vaccines help people who are at risk of severe infections not have severe infections, and that's a good thing. You know, I do advise vaccination for a certain demographic, but these types of mandates are not science-based, and this is what I'm trying to show here. They're just not science-based. They're situation-based. Now, this is even more ridiculous. So work restrictions for asymptomatic healthcare providers with exposures, right? So conventional is if you're boosted, so there's difference here. If you're boosted, there's no work restrictions with a negative test on days 2 and 5 and 7. If you're vaccinated or unvaccinated, which is here, even if within 90 days of prior infection, if you had an exposure, you are supposed to stay out of work for 10 days or 7 days with a negative test. Okay, so I am an unvaccinated healthcare provider, emergency room doctor, and over the last 3 days, I have probably seen 10 or more people with COVID. I had previous infection, but I've seen 10 or more people with COVID. So I've been exposed 10 or more times, and I'm exposed every single day. So basically, if this was even followed by anybody, which is not, this is not followed by anybody, we would never be able to work. The hospitals were shut down. Even if you're boosted and you have an exposure, which is literally what we do every day, we treat patients with COVID every single day, they should be getting tested. So everybody should be getting tested all the time. Of course, if you are quote unquote exposed and you're not vaccinated or not boosted, which is basically what this column is. This column just says not boosted. In a contingency or a smaller crisis, there are no work restrictions with negative tests on days 1, 2, 3, and 5 and 7. So you're supposed to get tested 5 times. And in a crisis, it doesn't matter. So basically, the way we're operating now is like this. This is where we are. We get exposed to COVID every single day. Every single day. Multiple times a day. Whoever works in the ER can see it. And this is how we work. And CDC comes up with these guidelines. I don't think they work in a hospital. You know, they just kind of work behind a desk and they don't understand what's happening in the hospitals. So this is what we're calling science, and this is just ridiculous. It's not based in reality. And the fact that they're willing to make these, changes, all of a sudden say, hey, now this is okay if there's a crisis, while at the same time creating crisis by saying that this is not okay. If you are not boosted, we're going to fire you, is just kind of mind-boggling. So this is what we're dealing with, and this is why everything is so difficult. So I just wanted to make this video to show how ridiculous all this is. That's it.